Did you know that your body often tries to tell you when your heart is struggling long before a serious problem appears? Most of us brush off subtle signals, attributing them to stress, aging, or simply being tired. But what if the fatigue you feel every afternoon, the shortness of breath when climbing stairs, or even the swelling in your feet is your heart quietly asking for help? Heart failure doesn't happen overnight. It develops gradually, often unnoticed, until it begins to interfere with the things you love most. Walking your dog, spending time with family, or even just getting through the day without feeling exhausted. And the problem is that many of these early warnings are easy to dismiss, easy to ignore, and unfortunately, easy to miss. But recognizing them early can make a profound difference. Early detection allows you to take action, prevent complications, and preserve your independence and quality of life. Today, I want to guide you through 13 subtle but important signs of heart failure that seniors often ignore every day. And I'll also share simple steps you can take to protect your heart before it's too late. Let's start with the first thing many seniors experience but rarely talk about: unusual fatigue. This isn't the kind of tiredness that comes from a long day of activity or a restless night's sleep. This is fatigue that seems to hang around, persistent and unshakable, no matter how much rest you get. You might notice it when trying to climb a single flight of stairs, or even walking to the mailbox feels like a major effort. Some people report feeling so drained after ordinary tasks like cooking, cleaning, or gardening that they need to sit down immediately afterward. Many seniors assume that this is just a part of getting older. I'm slowing down, they think, or I've just got less energy than I used to. But fatigue caused by a weakened heart isn't just about age. When your heart can't pump blood effectively, your muscles and organs don't get enough oxygen, and your body's energy supply drops. That's why even small tasks can leave you feeling exhausted. Paying attention to unusual fatigue is crucial, because it's often one of the first warning signs of heart failure, long before other symptoms become obvious. Another early signal is shortness of breath. Again, this may seem normal at first. You might think, I'm just out of shape, or I've got a little asthma. But shortness of breath that happens during routine activities like climbing stairs, bending over, or walking a short distance may indicate that your heart isn't circulating blood efficiently. Some seniors experience breathlessness only at night. They wake up suddenly, gasping for air, or find themselves needing to sleep propped up on multiple pillows just to breathe comfortably. This happens because when your heart can't pump properly, fluid can build up in your lungs. Even mild episodes of breathlessness that come and go should not be ignored. Over time, this fluid accumulation can worsen, making daily activities increasingly difficult and leaving you feeling anxious or drained. The key is to notice patterns. If you find yourself consistently short of breath, doing things that used to feel easy, it's time to take it seriously and check in with a healthcare professional. Swelling in the legs, ankles, or feet, also known as edema, is another warning sign that many seniors overlook. You may notice that by the end of the day, your shoes feel tight or your socks leave deep marks in your skin. Some people dismiss this as a natural consequence of standing too long or a hot day, but when swelling is persistent or gradually worsening, it often points to your heart struggling to pump blood effectively, causing fluid to leak into surrounding tissues. This can also happen in your abdomen, making your stomach feel bloated or uncomfortable. Edema might seem minor at first, but it can indicate that your heart is under strain. Ignoring it allows fluid to continue accumulating, which may lead to more serious complications such as difficulty breathing or rapid weight gain. Keeping track of swelling daily, noting which parts of your body are affected and how it changes throughout the day, can provide essential early clues to your heart's health. A rapid or irregular heartbeat is another subtle but telling sign. You may notice your heart racing unexpectedly, fluttering in your chest, or even skipping beats. Some people experience palpitations while resting, lying in bed, or even during light activity, and often dismiss them as stress or caffeine intake. But these irregular rhythms are usually your heart trying to compensate for weakened pumping function. Over time, if left unchecked, this strain can lead to serious arrhythmias or even increase the risk of stroke. It's worth noting that palpitations can be scary, and noticing them early is key. Even if they seem occasional or harmless, tracking when they occur, what you were doing at the time, and discussing them with a doctor can be life-saving. A simple EKG or heart monitoring test can reveal a lot about your heart's rhythm and function, helping your doctor take preventive measures before more severe complications occur. Persistent coughing or wheezing may seem unrelated to your heart, which is why it's often ignored. Many seniors blame it on allergies, a lingering cold, or seasonal changes. However, a chronic cough that produces white or pink-tinged mucus can be a sign that fluid is building up in your lungs because your heart isn't pumping effectively. This symptom is particularly noticeable when lying down, as the fluid shifts in your body and makes breathing more difficult. Even if the cough isn't severe or painful, when it persists over weeks or months, it's a red flag. Ignoring it might allow fluid to continue accumulating, further straining your heart and leading to increased fatigue and discomfort. Paying attention to a persistent cough and discussing it with a healthcare professional can reveal underlying heart issues early, potentially preventing more serious complications. Sudden, unexplained weight gain is another early signal that's easy to miss. Gaining 2 to 3 pounds in just a few days without changes in diet or activity is often caused by fluid retention, a hallmark of early heart failure. Unlike typical weight fluctuations from food or water, this type of gain reflects your body retaining excess fluid due to the heart's inability to pump blood efficiently. Monitoring your weight daily, especially for seniors, is a simple yet effective way to catch early warning signs. Even small, gradual increases should not be dismissed, particularly when combined with swelling in the legs or fatigue. Early recognition allows for interventions such as adjusting diet, managing salt intake, and seeking medical evaluation before the problem escalates. Loss of appetite or nausea is another subtle symptom that many seniors don't associate with heart health. When your heart can't pump effectively, blood flow to your digestive system is reduced. This can cause bloating, a feeling of fullness after only a small meal, or intermittent nausea. Many people dismiss these symptoms as just aging or attribute them to other digestive issues. But when combined with fatigue, swelling, or shortness of breath, they can signal early heart failure. Paying attention to changes in appetite and digestive comfort, and discussing them with your healthcare provider, is crucial. Early action not only supports heart health, but also ensures you maintain proper nutrition, which is essential for overall well-being. Difficulty sleeping while lying flat is another sign that often sneaks under the radar. Many seniors find themselves propping up with extra pillows, sleeping in a recliner, or waking up at night short of breath. This happens because fluid that has pooled in your legs during the day shifts toward your lungs when lying down, making breathing more difficult. Over time, this can lead to poor sleep quality, increased fatigue, and worsening heart function. Recognizing this symptom early and discussing it with a doctor can lead to interventions that improve both heart health and sleep quality, such as lifestyle changes, fluid management, or medical treatments. Even subtle changes in thinking or memory can be tied to early heart failure. Reduced blood flow to the brain can cause confusion, difficulty concentrating, or slower thinking. Seniors and caregivers often dismiss these changes as normal aging, but sudden or progressive cognitive difficulties can indicate that the heart isn't supplying enough oxygen-rich blood to support optimal brain function. Recognizing these changes early, combined with other symptoms like fatigue or shortness of breath, can guide timely interventions that protect both heart and brain health. Mild chest discomfort or pressure is another early warning that many seniors tend to overlook. Unlike the sudden, severe pain associated with a heart attack, this discomfort is often subtle, sometimes just a feeling of tightness, heaviness, or mild pressure in the chest. It might appear during light activity or even at rest, and it often comes and goes, which is why many dismiss it as indigestion, stress, or simply a part of getting older. But your heart is signaling that it's under strain, and even mild discomfort should never be ignored. Paying attention to these subtle sensations and reporting them to a healthcare professional can help catch heart problems early, potentially preventing serious complications down the line. Frequent urination at night, medically known as nocturia, is another symptom linked to early heart failure. You might notice that you're waking up 1, 2, or even 3 times during the night to urinate, even though you haven't changed your fluid intake. During the day, Fluid often accumulates in the legs and lower extremities due to weakened circulation. When you lie down at night, this fluid redistributes and travels to your kidneys, leading to increased nighttime urination. While nocturia can be caused by other factors such as diabetes or kidney issues, when it occurs alongside swelling, fatigue, or shortness of breath, it may indicate that your heart is struggling to maintain proper fluid balance. Tracking these changes can provide crucial insights into your heart health and help guide timely medical evaluation. Cold hands and feet may seem trivial, but they can be a subtle sign of poor circulation caused by heart failure. When the heart is unable to pump blood efficiently, extremities may not receive adequate oxygenated blood. You might notice that your hands or feet are constantly cold, numb, or tingly, even in warm conditions. Sometimes this symptom is dismissed as a result of being outside in cool weather, but persistent coldness, especially when paired with other early signs, warrants attention. Improving circulation through lifestyle changes, regular exercise, and medical management can help, but the first step is recognizing the symptom and understanding its connection to heart health. Exercise intolerance is perhaps one of the most telling signs of early heart failure. Activities that used to be easy, walking short distances, climbing a few steps, or doing light household chores, may suddenly feel exhausting. You may notice that your heart races faster than usual, your breathing becomes labored, or your muscles feel unusually weak. Over time, your ability to perform everyday tasks diminishes, and even simple physical activity feels like a major effort. Exercise intolerance is a clear indicator that your heart isn't supplying enough oxygen-rich blood to meet your body's demands. By recognizing this early and discussing it with your doctor, you can take steps to manage heart function, build endurance safely, and prevent further decline. Now that we've covered all 13 early signs, it's essential to understand why these symptoms are so often ignored. Many seniors attribute them to normal aging, assuming that fatigue, mild swelling, or shortness of breath is just part of getting older. Others think it's stress, poor sleep, or lifestyle habits. Even medical professionals sometimes need careful observation to spot the subtle patterns indicating early heart failure. But ignoring these signals can lead to serious complications, including severe fluid buildup, arrhythmias, hospitalizations, and decreased quality of life. Awareness is your first line of defense, and timely recognition allows for interventions that can prevent worsening heart function. Prevention and proactive management play a critical role in protecting your heart. A heart-healthy lifestyle is one of the most effective ways to reduce risk and slow the progression of heart failure. This includes maintaining a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, while limiting salt and processed foods. Excess sodium can cause fluid retention, placing additional stress on your heart. Regular physical activity, tailored to your abilities, helps improve circulation, strengthen your heart muscle, and enhance overall energy levels. Even light daily walks, gentle stretching, or chair exercises can make a significant difference. Managing underlying health conditions such as high blood pressure, diabetes, and high cholesterol is equally important, as these can directly impact heart function over time. Monitoring your body closely is another key strategy. Keeping track of your weight daily can alert you to sudden fluid retention. Note changes in swelling, breathing, energy levels, and appetite. Small shifts over time can provide essential clues to your heart's condition. Combining this self-awareness with regular checkups, routine lab work, and timely communication with your healthcare provider ensures that potential issues are addressed before they escalate. Early medical intervention can prevent hospitalizations and significantly improve quality of life. Patient stories can help illustrate the importance of early recognition. Take, for instance, Mrs. Allen, a 72-year-old retired teacher, who noticed she felt unusually fatigued and started waking up at night gasping for air. At first, she thought it was just part of getting older. Over several weeks, she also noticed swelling in her ankles and mild chest tightness. When she finally consulted her doctor, early-stage heart failure was diagnosed. With medication adjustments, lifestyle changes, and regular monitoring, Miss Allen was able to regain her energy, sleep comfortably again, and prevent the condition from progressing. Similarly, Mr. Johnson, a 68-year-old retiree, dismissed his occasional palpitations and nighttime urination until he connected these symptoms with his fatigue and cold extremities. Early evaluation revealed his heart was struggling, but timely treatment and daily monitoring helped him regain stability and avoid hospitalization. Recalling all 13 early signs is vital. Unusual fatigue, shortness of breath, swelling in legs or feet, rapid or irregular heartbeat, persistent cough or wheezing, sudden weight gain, loss of appetite or nausea, difficulty sleeping while lying flat, confusion or impaired thinking, mild chest discomfort, frequent nighttime urination, cold hands and feet, and exercise intolerance. Even if you recognize just one or two of these in yourself, it's worth consulting a healthcare professional. Early action allows for interventions that can preserve heart function, enhance daily energy, and maintain independence. Don't underestimate your body's subtle signals. Heart failure may sound frightening, but the truth is empowering. Awareness and early response can prevent serious complications and dramatically improve quality of life. Listen to your body, track changes, and communicate openly with your doctor. Simple lifestyle adjustments, consistent monitoring, and proactive care can make a profound difference. Protecting your heart isn't just about medical intervention. It's about understanding and responding to the subtle ways your body tells you it needs help. Share this knowledge with loved ones. Encourage them to pay attention to these warning signs and take steps together to maintain heart health. Your heart communicates long before a crisis occurs, and responding early is the most effective way to preserve your life, energy, and independence. Every subtle symptom matters, and acting now can prevent problems later. Remember, a healthy heart is the foundation of every activity you enjoy, whether it's walking, gardening, spending time with family, or simply getting through your day with energy and confidence. By recognizing these early signs and taking steps to support your heart, you are giving yourself the best chance for a long, active, and fulfilling life. Don't wait for severe symptoms to appear. Pay attention, respond early, and make your heart a priority today. Now let's take a closer look at mild chest discomfort, a symptom that many seniors often ignore because it doesn't always feel like the dramatic, sharp pain you hear about in heart attacks. Instead, it may present as a dull pressure, a sense of heaviness, or a subtle tightness in your chest that comes and goes. Some seniors notice it during mild activity, while others feel it even when resting. It can be easy to attribute this to indigestion, stress, or even normal aging. But here's the important point. Your heart may be sending warning signals that it's under strain. Mrs. Simmons, a 70-year-old retiree, experienced mild pressure in her chest while gardening and brushing it off as fatigue from the day's work. When she consulted her doctor in person, tests revealed early-stage heart failure. With proper intervention, lifestyle adjustments, and medication, her symptoms improved, and she avoided further complications. This example illustrates why it's crucial to consult a doctor physically whenever you notice even mild or intermittent chest discomfort. Don't wait for severe pain. Early evaluation can save your heart and your life. Frequent urination at night, medically called nocturia, might feel inconvenient, but is a subtle signal of early heart issues. When fluid accumulates in the legs during the day due to weakened circulation, lying down redistributes this fluid to the kidneys, leading to increased nighttime urination. While nocturia can also stem from conditions like diabetes or kidney problems, combined with other symptoms such as swelling, fatigue, or shortness of breath, it often signals that your heart is struggling to maintain proper fluid balance. Patel, a 68-year-old gentleman, noticed himself waking up 2 to 3 times nightly. Initially, he assumed it was due to aging or too much water before bed. When he discussed it with his physician during a physical consultation, the underlying issue was identified as early heart failure. This underscores the importance of seeing a doctor in person to assess symptoms and rule out or treat heart-related causes. Cold hands and feet, while seemingly minor, can also indicate poor circulation linked to early heart failure. When the heart cannot pump blood efficiently, extremities receive less oxygenated blood, leading to persistent coldness, numbness, or tingling. Seniors often dismiss this symptom, thinking it's just a reaction to cold weather. But when it is chronic or paired with swelling, fatigue, or shortness of breath, it can reveal that the heart is under strain. Miss Rodriguez, a 71-year-old grandmother, noticed her fingers and toes were always cold despite wearing warm socks. Upon consulting her doctor in person, tests showed that her circulation was compromised due to weakened heart function. Simple interventions, including medication, gentle exercise, and lifestyle adjustments, improved her circulation significantly. This demonstrates why even subtle changes should prompt a physical consultation with a healthcare provider rather than being ignored. Exercise intolerance is often one of the most telling yet overlooked signs. Activities that were once effortless, walking short distances, climbing stairs, or performing light household chores, may suddenly feel exhausting. Your heart may struggle to deliver adequate oxygen-rich blood to your muscles, leaving you fatigued quickly. This symptom often develops gradually, making it easy to dismiss. Mr. Thompson, a 69-year-old retiree, realized he could no longer keep up with his morning walks or carry groceries without resting halfway. Initially, he attributed it to aging, but a thorough physical examination revealed early heart failure. With medical guidance, lifestyle modifications, and a structured exercise program, he gradually regained stamina. This shows how critical it is to consult a doctor physically whenever you notice a decline in exercise tolerance to identify the underlying cause and prevent worsening heart issues. Understanding why these early signs are often ignored is essential. Many seniors assume that fatigue, shortness of breath, swelling, or mild chest discomfort are just normal aspects of aging. Others blame stress, poor sleep, or lifestyle choices. However, when these signs cluster together, they frequently point toward early heart failure. Ignoring these subtle signals can lead to serious complications, including hospitalization, worsening fluid buildup, arrhythmias, or a sudden decline in heart function. Being proactive and attentive to these early warnings, combined with a physical consultation, is crucial in preserving your heart health and preventing escalation. Proactive prevention and management are critical. A heart-healthy lifestyle is the first line of defense against heart failure progression. Diet plays a key role. Prioritize fresh fruits, vegetables, whole grains, lean protein, and healthy fats, while reducing sodium, processed foods, and sugary snacks. Excess salt can exacerbate fluid retention, placing extra stress on a weakened heart. Moderate exercise tailored to your abilities supports heart and lung function, enhances circulation, and boosts energy levels. Even light activities such as daily walks, gentle stretching, or chair exercises can make a substantial difference. In addition, managing underlying conditions like hypertension, diabetes, and high cholesterol is vital, as these factors directly impact heart function. Monitoring your body closely is also an essential tool for early detection. Keeping a daily record of your weight, noting swelling in your legs or ankles, tracking energy levels, and observing changes in breathing or appetite can reveal patterns that indicate early heart strain. Coupled with regular checkups, these measures help you and your doctor catch issues before they worsen. Remember, while tracking symptoms at home is valuable, it cannot replace a physical consultation with your doctor, who can perform detailed examinations, diagnostic tests, and prescribe appropriate interventions. Early medical attention provides clarity, reassurance, and a roadmap for proactive heart care. Patient stories highlight the importance of early recognition and action. Mrs. Allen, a 72-year-old retired teacher, noticed fatigue, swelling, and shortness of breath, but initially ignored them. After consulting her doctor physically, she was diagnosed with early-stage heart failure. With lifestyle changes, medication, and regular monitoring, she regained energy, improved her sleep, and avoided hospitalization. Mr. Johnson, a 68-year-old retiree, ignored palpitations and nighttime urination, attributing them to aging. After a physical consultation revealed underlying heart issues, timely interventions restored his heart function and prevented further complication. These stories illustrate a simple truth: early evaluation and proactive care can prevent serious outcomes and allow seniors to maintain independence and quality of life. To recap, the 13 early signs to watch for are unusual fatigue, shortness of breath, swelling in the legs or feet, rapid or irregular heartbeat, persistent cough or wheezing, sudden weight gain, loss of appetite or nausea, difficulty sleeping lying flat, confusion or impaired thinking, mild chest discomfort, frequent nighttime urination, cold hands and feet, and exercise intolerance. Recognizing even one or two of these signs is significant. Ignoring them can result in serious complications, while addressing them early allows for intervention, symptom management, and improved overall health. It is essential to take these signs seriously and consult a doctor in person to evaluate any of these symptoms. Only a physical examination, combined with appropriate diagnostic tests, can determine whether heart failure or another condition is causing these early warning signs. Timely action empowers you to maintain heart function, protect your independence, and live life fully. Even subtle signals are meaningful. They are your body's way of communicating that it needs attention. Your heart is central to every activity you enjoy, from walking and gardening to spending time with family and friends. Protecting it requires awareness, proactive lifestyle choices, and timely medical evaluation. Pay attention to changes in energy, breathing, circulation, and appetite. Track symptoms over time, discuss them with your doctor physically, and implement lifestyle strategies that support heart health. Awareness and action, taken together, can prevent complications, improve daily functioning, and help seniors maintain a high quality of life. Remember, early detection is the key to preventing serious heart issues. Your body sends signals for a reason. Listening, responding, and consulting your doctor physically are the steps that protect your heart and your life.